This video will cover chronic myeloid leukemia, a myeloproliferative neoplasm. To anchor ourselves, we're going to use this friendly looking camel here, since if you were to shorten the word camel, you could get to CML. To remember that CML is a myeloproliferative neoplasm, all we have to do is keep in mind this huge billboard here for a company that sells submarines, I guess. The name of the company is Metropolitan, which if you shorten the word metropolitan, you can get to MPN, just like myeloproliferative neoplasm. Since we're talking about the billboard, let's talk about this mega submarine they are advertising. This is to help us remember that these patients commonly present with splenomegaly. Our symbol for splenomegaly is a submarine because the word submarine sounds like spleen. And because this is a mega submarine, we'll remember splenomegaly. CML is defined by presence of the Philadelphia chromosome, which is a result of a reciprocal translocation of chromosomes 9 and 22 that produces the BCR-ABL1 fusion gene. To help us remember Philadelphia, we have, of course, as in other videos, a stand selling cream cheese from that one most famous brand. And to help us remember 922 translocation, take a look at the shoes the camel is wearing here, which are wrapped in vines. The word shoe sounds like the number 2. The word vine sounds like the number 9, and that's what we're going to use to remember 922. The camel is even wearing 2 pairs of shoes to help us remember 22. Lastly, if you notice, I guess the shoe brand decided to put these DNA molecule logos on them. That'll really cement for us that we're referring to chromosomes 9 and 22 since our symbol for chromosomes is the color chrome with a DNA molecule. To help us remember BCR-ABL, look at this lab beaker here. If you were to pronounce BCR, it would sound like beaker, right? And since this beaker has a cable around it, we're going to remember ABL because ABL sounds like cable. The translocation in CML produces a fusion protein called P210, and even though this scene is set in a desert, it looks like this character has her priorities set straight in terms of working out, because look at her drink. It's a new type of protein shake called P210 fusion. This, of course, represents the fact that CML produces a P210 fusion protein. One ancillary test for CML is a platelet aggregation test. These patients tend to have impaired platelet aggregation in response to epinephrine. Let's break this one down. You see that pile of broken plates? Plates are our symbol for platelets, and since there are multiple plates, we're going to remember that these patients tend to present with thrombocytosis. Next, since the plates are all broken and piled up on each other, we're going to remember the platelet aggregation defect. And to tie this all together with the fact that this defect is in response to epinephrine, take a look at the janitor here. He looks pretty stressed, right? Him being stressed will point us towards epinephrine. No further explanation needed on that one. Okay, moving on now to one of the features of chronic phase CML. In chronic phase, these patients tend to present with leukocytosis due to increased neutrophils in all stages of maturation. There is one granulocyte in specific, however, that tends to be increased in comparison to other immature granulocytes, and that is the myelocyte. This is called the myelocyte bulge. To help us remember myelocyte bulge, we have this apple here with a sort of bulge on it. In Greek, the word apple is myelo, and doesn't myelo sound like Milo? A helpful feature to look for in CML is basophilia and eosinophilia. Basophilia is represented by this blue baseball bat, since the word basophil sounds similar to baseball, and since basophils have blue to purple granules. To help us remember eosinophil, well, take a look at this nice bowl of oatmeal here with some raspberries. Oatmeal sounds close to eosinophil. And there are even some raspberries on it to help us remember the eosinophilic granules. Something that tends to come up often on test questions is the LAP, or leukocyte alkaline phosphatase test. In theory, this is a test that can be used to distinguish CML from leukemoid reaction. CML should have a low LAP score, while the leukemoid reaction will be high. To represent LAP, we have a random laparoscope here next to the janitor. Interesting choice of janitorial tool, but hey, I'm sure he has his reasons and methods. The word laparoscope starts with the letters LAP, and since the laparoscope is on the ground, we're going to remember that LAP score is low in CML. Taking us back to those general surgery days, holding the camera during a laparoscopic surgery and getting yelled at by a surgeon, huh? There weren't many words that sounded like or are spelled with LEP, so work with me on this one, okay? The marrow is expected to be hypercellular in these patients, and just like in other videos, this is represented by this overflowing bone broth drink. Let's move on. Another important finding in the marrow is increased megakaryocytes with a distinct small and hypolobated morphology. These megakaryocytes are often referred to as dwarf megakaryocytes. Our symbol for megakaryocytes is none other than this character that looks eerily similar to Meg from Family Guy. Meg sounds like megakaryocyte, and the fact that she has this battle axe and chainmail will remind us of dwarf megakaryocytes because of that one famous character from the Lord of the Rings movie who is a dwarf and uses a battle axe as his weapon of choice. Treatment with imatinib, which is a tyrosine kinase inhibitor, results in prolonged survival. To represent imatinib, notice this nice welcoming doormat in the scene. The word mat is in imatinib, and that's what we're going to use.